Well, welcome, everybody. I think we'll get started. I wanted to welcome you to this edition of DocTalks, where we hope to answer your questions on the vaccine, give you some information about where the vaccine is. Yeah, we have with us, we're lucky to have with us today Zarif Akbarian from Mosaic, who's the coordinator and health navigator and a seniors community connector there, and he'll be translating into Dari on a separate channel. So I just wanted to let you know that this will be recorded, and for those folks who are unable to attend today, the Dari recording will be made available. So you'll have an opportunity to share it at a later date. All of these recordings, including past Doc Talks around the vaccine and other subjects, are available on the Burnaby Primary Care Network's website. It's burnabypcn.ca. And as well, there are a number of other resources there that are available for social supports in the city, as well as health and clinical supports. So lots of opportunity there. So again, I'd like to introduce Dr. Baldev Sanghera. We're fortunate to have Dr. Sanghera with us. Dr. Sanghera is a leader in our community as a family doctor, a leader in our primary care network. He heads up the Edmonds Urgent Primary Care Center and a number of other initiatives with the PCN. He's also a leader in the vaccine movement. He's a local leader of the This Is Our Shot campaign, which is where you can see it on his T-shirt, and and he's been a strong voice for the community in Burnaby and the broader community as well. So really fortunate to have Dr. Sanghera with us. At this point, I'd like to turn it over to him.
Thanks, Jeff. I'm going to share my screen with you. So let's do this. And so welcome to our talk on COVID-19 and the vaccines that are available to help us mitigate any risk from them. I will be giving a broad discussion regarding the COVID-19 virus itself to begin with. And then we will talk about the vaccines and other options to reduce our risk. If anyone has any questions, please pass them to the translator or put them into the chat. So COVID-19 is a type of coronavirus. It's a virus, a small infectious particle that is identified as a coronavirus, meaning it's got these little spikes on the surface. We've all seen the pictures that are depicted on TV. COVID-19 is spread through the air and through water droplets that come out of our mouth or our nose. The virus can cause respiratory infection, and it can also cause inflammation of our organs. Most common inflammation in our organs is in the heart, in the lungs, in our kidneys, and in our brain, and sometimes in our muscles and joints. We will talk some more regarding this, the symptoms that it causes in another slide later on. The COVID-19 virus has an approximate 2% death rate. So all of the infections that occur from this virus, 2% of the people that catch this infection can die. 30% of COVID-19 patients, after they recover from the actual acute infection, end up having long-term symptoms. Usually the infection lasts anywhere from 3 to 5 days, up to, with these long-term symptoms, they can last for 6 to 12 months and possibly even longer. We're still monitoring some patients that have the long-term impacts. This is a serious virus. It has been able to transmit itself around the world. There is no country on Earth that has not been affected. Some countries have been fortunate to be able to control it, as we have here in Canada, and other countries have not been so fortunate. In the world, total, as of yesterday, we have a total of 193 million reported cases, and the number of reported deaths at the start of this pandemic have now come to 4,155,000, which approximates to about 2.2% mortality. One thing that I do want to clear up though, these are reported numbers. Actual real numbers are much higher. In some countries where they have poor public health reporting systems in place, some people are not recorded as having died from COVID. They are often just found dead and nobody knows why. As an example, in India, the reported number of people having died from COVID is 400,000, but actual numbers are more likely to be around 4.7 million. We have successfully rolled out vaccines around the world. As of yesterday, 1.35 billion first dose vaccines have been given to people, and about it should be 300 million second doses around the world. In Canada, we have had a total of 1.4 million cases, and approximately 26,000 people have died from this infection. In Canada, we have given 47 million doses of the vaccine, of which 70% are first doses and 53% are second doses. In BC, we had in March, April, we had a very strong wave of infections occur. And we were seeing more than 1,000 cases per day on average in April. During that time, when the cases were high, hospital systems were overwhelmed, and our health authorities had to cancel approximately 1,000 surgeries per week, which we now have to catch up once the pandemic is better controlled. As you can see from this, the impact of the virus is not just on how many people it makes sick or how many people die from the infection, but also how then, as we increase the number of people infected, how they can overwhelm our public health system, then leading to other aggravations and death and suffering. In BC, we have had 1,763 people die, unfortunately, since the beginning of the pandemic. We have a total of 148,730 cases, most of which of the people have recovered. As of yesterday, our daily average is now 70 positive cases per day. Yesterday was 89, but the average for the week is around 70. And we have a 1% positivity rate. We have been successful in reducing our virus spread, but we have not been able to eliminate it. So we still need to be careful. We still currently have 53 people in hospital, out of whom 16 people are in serious condition in ICU. We have had a lot of vaccine distributed. We have given 6.36 million doses of the vaccine in BC. And out of the people that are 12 years and older, we have provided 80.2% first doses and 56.9% second doses. This means that in the total population, including young children, we have vaccinated first dose 72% and second dose 51%. In order to achieve what we call herd immunity, where we have enough people protected so that the virus spread is limited, our target is 90%, 2 doses. In April, the chance of getting COVID infection was 1 in 4,700. And what we noticed throughout the last 15 months is as people get older, the risk of death from the COVID infection increases. So people under 55, their risk of dying from the infection is 3.2% if you get infected. If somebody over the age of 85 catches the infection, their risk of dying is 68.3%. 80% of the deaths that occurred due to COVID-19 in Canada have been in adults older than 65 years old. This is the reason that we started to vaccinate older people first in order to reduce the number of people that died. Currently, in people older than 75, approximately 95 to 97% have had 2 shots of the vaccine, and very few of them are getting sick. The current spread of the infection is in the younger people under 50 who have not been vaccinated. The long-term symptoms that we were talking about on the earlier slide due to COVID-19 are that you can still continue to have respiratory difficulty, difficulty breathing, shortness of breath with walking or going upstairs, general weakness and muscle fatigue, what we call brain fog, where you have difficulty concentrating on what you are thinking about and talking. Poor circulation, especially in the fingertips and the toes. The poor circulation has also resulted in erectile difficulty in men, as we have also noticed an increase in anxiety and mental health issues after the infection. These are the reasons why we are trying to control the infection from spreading, because even if you have a mild infection, you can still, you have a 30% chance of having long-term symptoms. How do we decrease the spread of COVID-19? There's 5 very effective ways that we have access to. One is to wear a mask in public. Prior to the start of July, we had a mandatory direction from the government that we all had to wear masks. Currently, it is a recommended piece of direction. My advice is if you can wear a mask anytime that you are in public, in large groups, in poorly crowded, poorly ventilated spaces, please wear your mask. A very effective protection. The other advice is to wear the mask properly. And to wear the mask properly, you have to cover the nose and the mouth, not just the mouth, and certainly not just the nose. Both have to be covered. Second thing that we can do is to maintain at least a 6-foot distance from people that we are unsure of their vaccination status or their infection status. The closer you go to somebody, the higher the risk. If possible, try to avoid crowds and poorly ventilated rooms, because it is in that situation that the virus spreads more and faster. I have treated many families where they have had social functions to get together. One person comes in who's asymptomatic but positive for the infection, and they have ended up infecting 80 to 90% of the other family members. Asymptomatic means that you do not have any symptoms that you are aware of, but you can be carrying the virus. So it's difficult to tell who is infected and who isn't. Fourth way to protect yourself is to repeatedly wash your hands, especially if you're touching things that other people have touched. Anytime you go to touch your face, please wash your hands. The final thing that we can do is to get a vaccine. So which vaccines are available in BC? We are extremely fortunate. We have had a lot of vaccine available to us, and I will describe the 5 different types that have been approved by Health Canada. All of these vaccines have also been approved by the World Health Organization. The 2 main types of vaccine that we have access to currently are the Pfizer vaccine and the Moderna vaccine. These 2 vaccines are what are called messenger RNA vaccine. These vaccines contain a small amount of protein that teaches our immune system which antibodies to make to be able to fight the virus. These vaccines do not contain any virus particles. They are very simple vaccines that do not have too many components, and hence they don't have many side effects. Both of these vaccines require 2 doses, approximately 6 to 8 weeks apart. Both of these vaccines are currently available at all vaccine clinics. Which vaccine you receive depends on the supply for that day. Both of these vaccines are equally effective and highly effective, and we should consider them to be equivalent, kind of like choosing between Pepsi and Coca-Cola or BMW and Mercedes. The next vaccine is AstraZeneca. This one is called a vector vaccine, so it contains an inactivated virus particle to teach our immune system how to produce antibodies to fight the virus. This vaccine also requires 2 doses. Currently, it was available before. Currently, we do not have any AstraZeneca vaccine available to give to anybody, but it is being used widely around the world. Some people here in Canada may have received the AstraZeneca vaccine as their first dose. A few received it as their second dose, but a lot of the people that received it as their first dose are receiving a second dose from Pfizer or Moderna. This is mixing is considered to be safe and has been approved by the European Medicine Agencies, Health Canada, the National Advisory Council on Immunization, and the Ministry of Health in the UK. The other 2 vaccines are available here, Johnson Johnson, that have been approved here in Canada, Johnson Johnson and Novavax. Unfortunately, they are not available yet, and they may not become available until later in this year or early next year. So I'm not going to talk about it too much because currently the only 2 vaccines that are available locally are the Pfizer and Moderna vaccines. When you go to the vaccine clinic to get your injection, what you can expect on that day is where the injection is given in the shoulder muscle up here, you will have some soreness. Initially, you will have pain from the injection, obviously with the poking a needle into your arm. But a lot of people end up, I'd say about 30 to 40% end up having soreness at the site of the injection later that day. They may also experience tight muscles over their whole body. They may experience fatigue, tiredness, mild fever, some congestion in the nose or in the back of the throat, and a few people have also reported diarrhea. This is nothing to be too worried about because these are known common side effects, but this is a response to your immune system gearing itself up to produce antibodies to fight the virus. These milder side effects clear within 48 to 72 hours. If you get these side effects after your vaccination, an easy way to reduce the soreness, pain, fatigue, and fever is to take some Tylenol if required, and also if you don't have an allergy to Tylenol. If you have these side effects and they are bothering you, please feel free to call your family doctor or visit us at the Edmonds Urgent Care Center. Some rare side effects that are also possible and have been seen. First one is called reactive arthritis. Some people after vaccination, and this is very rare, they get joint pains that may last for a month or so. It is treatable and it clears up, it goes away. Again, if you have this side effect after the vaccine, please talk to your family doctor, and it is easily treatable. One other rare side effect that was discussed in the news was the risk of blood clots. And this was more common with the AstraZeneca vaccine. And approximately 1 out of every 100,000 people that had the AstraZeneca vaccine developed small blood clots in the brain. And the symptoms that people had were headaches, sometimes mildly blurry vision, and dizziness. If they reported those symptoms to their family doctor quickly, we were able to treat that very simply and get it under control. We are no longer giving the AstraZeneca vaccine in Canada because we don't have any supply. And so we are no longer seeing any more cases of these blood clots. Some people are unable to receive the mRNA vaccine, especially Pfizer, because they may have an allergy to a chemical called polyethylene glycol. Polyethylene glycol is a chemical that is very commonly found in processed foods, in makeup, in laxatives. So majority of us have been exposed to this chemical, and we don't have the allergic reaction to it, but it is possible. So if you are aware that you have this allergy, please do not get the mRNA vaccine. Now, we should discuss the comparison risk of developing blood clots, even if you don't have the AstraZeneca vaccine. AstraZeneca vaccine had a risk of 1 in 100,000 of causing blood clots in the brain. If you are not vaccinated and you catch COVID-19, your risk of developing blood clots is 1 in 100. If you catch COVID-19 and you end up in the hospital, your risk of developing blood clots is 1 in 5. That's a big difference between the risk of blood clots from the vaccine. The risk of blood clots is also present in many other situations. Generally, women aged between 15 and 45 have a 1 in 3,000 chance of developing blood clots naturally because of their own hormones. If they are on birth control, then that risk increases slightly to 1 in 1,600. And when they are pregnant, that risk increases a little bit further to 1 in 300. So again, it's safer to receive the vaccine than if you are pregnant or if you are taking birth control pills. According to Statistics Canada, the number of deaths caused by COVID-19 in 2020 exceeded all other causes of death except for cancer and heart disease. Hence, it's important to try to control this risk. Now, I would like to discuss with you some of the myths and conspiracy theories that I have heard about from some of my patients. And I would like to tell you the truth as to what the reality is. Some people have been spreading rumors that the vaccines can impact menstruation and cause hormonal problems. In reality, this is not true. We have not seen any change in a woman's hormones or menstruation after receiving a vaccine. Some people have been discussing that vaccination can cause infertility and difficulty in having children in young women after vaccination. Again, this is untrue. A lot of nurses that have gotten the vaccine in order to protect themselves while at work have been able to get pregnant quite easily during the last year. Also, we have seen a large study done in the US and in Europe, which showed that after vaccination, sperm production in men actually increases. So male fertility increases after the vaccination. And these are actual real statistics. They are not theories that I'm discussing. Some people have discussed about the safety of these vaccines in pregnancy. Without the vaccine, the risk of severe complications in pregnancy, if you get the COVID infection, is very high. On the previous slide, I had discussed that the risk of blood clots in women is 1 in 300 if they are pregnant. And if they get COVID, then the risk goes up to 1 in 5. If you get the vaccine, those risks are reduced. Also, if a pregnant woman receives the vaccine, then her baby, as it's developing, will naturally build antibodies against the COVID-19 virus. Getting the vaccine during pregnancy is a great way to vaccinate and protect 2 people with 1 injection. Some people have advised me that vaccines are a way of population control and are poison to kill people. This is not true. In fact, what we see is that the vaccines are saving lives, saving people from the complications of the disease, and protecting them. Some of you may have heard that the vaccines have microchips embedded in them, and that Bill Gates is trying to control the world through the vaccines. This is not true. Some people have tried to show that the magnets stick to the area where the vaccine is injected into your arm. Again, this is to show that there is some microchip in the vaccine in your arm, and magnets do not stick to that area. Some people have been afraid of getting the vaccine because they think that the vaccines contain COVID-19 virus, and that once you get the vaccine, they will spread the virus. This is not true. The Pfizer and Moderna vaccines absolutely have no virus particles in them. The AstraZeneca vaccine and the Johnson & Johnson vaccine have an inactivated cold virus, not a COVID virus. Anybody receiving a COVID vaccine does not spread the virus. Some of the patients that I've talked to who are hesitant about getting the vaccine, they have told me that they wish to wait and see how everybody else does before they get the vaccine. I don't think that this is the correct way to go forward, because when you're waiting and watching everybody else, you are actually at risk of catching the infection. There have been many times in the hospital when somebody has caught the infection while they were waiting to see how everybody responded to the vaccine, gotten very sick, and in the hospital, they are asking us to give them the vaccine at that time. Unfortunately, that is too late, and we can't give them the vaccine. We can only give them the vaccine after they recover. But by that time, the current virus infection will have already caused some damage in their body. So the best way to prevent damage to your body from the virus infection is to get the vaccine ahead of time while you're feeling well. Some people have told me that they don't want to get the vaccine because it's not 100% effective. And yes, it's true. The vaccines are not 100% effective. They are between 90 and 95% effective. There is a small chance, 5 to 10% chance, of having a COVID-19 infection after having 2 doses of the vaccine. If a person gets infected after they have received both doses of the vaccine, the risk of complications is low. The severity of the illness they will suffer is mild. And the risk of them dying or ending up in the hospital is minimal. The risk of dying or ending up in the hospital after vaccination is 0.2%. So the advice remains that the benefits of the vaccine far outweigh the risks in the majority of people. Your risk of being infected with COVID-19, being hospitalized, and dying outweighs your risk of all rare side effects combined. My advice and the advice from Health Canada is please get your shots, both of them, not just one, but 2. And please accept whichever Canadian approved vaccine is offered to you and focus on the rest of your health needs, and let's get life back to normal.
Great. That's great. Thank you, Dr. Sanghera. I'm wondering if we may have a couple of questions. I don't, is it good or not advisable for breastfeeding mothers to have the vaccine?
Oh, no, in breastfeeding mothers, it's actually very good to have the vaccine. Obviously, again, those mild irritations of where the injection is going to be given, that will happen. But both the mom and the baby will have some protection. The mom will have a lot of antibody production, so she will be very safe. The baby will receive 10% of the mom's antibody production through the breast milk.
And
the baby will not have any side effects from the mom receiving the vaccine.
And another question, now you kind of addressed this, would any of the vaccines, is there any evidence that any of the vaccines would impact any hormonal changes in some people?
We actually haven't seen that. It's a theoretical risk that was posed by some people, but in reality, we have not seen any hormonal changes in men or women after they've received the vaccine.
There's been starting to be a discussion about the need for another booster. Sometimes we don't know if that's coming from the companies who make the vaccines or if it's coming from actual clinical evidence that might be necessary.
There's two parts to that, and we need to discuss why a booster may be needed, and the booster would be required if the virus mutates to create more variants. And currently, we see alpha, beta, gamma, and delta variants that are concerning. These variants are created in areas where there's a lot of spread. In countries where people are not being careful or they don't have access to vaccines, the virus spreads quite a bit. We are seeing that in the US, we are seeing that in the UK, and we have certainly seen it in the Middle East and in India. As the virus keeps spreading, it develops stronger variants that become more easy to transmit and can cause more symptoms. If we don't control the virus spreading in not just our country, but in other countries also, then the risk of more variants increases. As the variants keep increasing, our need for a booster will be more likely. And so, yes, the companies are already starting to talk about having to develop a new vaccine as a booster to provide more protection for us. But as a public policy, what we need to do is actually make sure that the vaccine is available to all countries around the world so that we're all equally vaccinated.
Thank you, Dr. Sanghera. I think that we really covered the scope of things today. This is wonderful. I don't see any more questions. So unless there are other questions, I'd like to again thank Zarif for his translation and thank Dr. Sanghera for a really great presentation. I want to remind you that folks, you will see a recording of this whole session, both in English and in Dari, available through the burnbypcn.ca website, as well as other DocTalk presentations by Dr. Sanghera and by other doctors in the community around a variety of subjects. Again, I want to thank everybody for joining us today. I hope you've enjoyed the presentation. I certainly know that I have. And thank you for coming, and we'll look forward to seeing you again.